This is Matt Walsh with your Minute with the Mayor for Friday, May 15th. 2 weeks ago, we began to reopen businesses that had been required to close by order of the governor. At that time, in Pottawatomie County, we had a total of 31 COVID confirmed cases since the disease arrived back in mid-March. In the last 2 weeks, we've added 100 more confirmed diagnoses. People will argue if the number has increased due to more testing or more disease spread. It's likely due to both testing and spread. What no one can argue is that the disease is still present and is virulent. In Pottawatomie County, the total number of confirmed cases sits at 131. 77 are currently self-isolating at home, 1 is hospitalized, 50 have recovered, and 2 succumbed to the effects of the disease. 1 individual has moved out of the county. With only 1 person hospitalized, there are currently adequate patient beds, ICU beds, and ventilators. Currently, we have no outbreaks in our jail or in our homeless shelters. Unfortunately, I report that we do currently have an outbreak in a Council Bluffs assisted living facility. Country House, which is a memory care center located on Canesville, has had multiple confirmed diagnoses and is awaiting test results of its residents and staff. Management is working closely with Pottawatomie County Public Health to contain the spread. Some bits and pieces from the news. The nation's average salary increased 7.9% in the first quarter compared to the same quarter last year, which sounds like great news until you consider that 40% of people earning $40,000 per year or less have lost their jobs, and those jobs no longer exist. Eliminating these lower paying jobs artificially increases the average salary. The World Health Organization, the health body that's been working to coordinate global efforts to combat the disease, warned again on Thursday of looming mental illness crisis, the result of the isolation, the fear, and the uncertainty brought on by the pandemic. The world could expect to see a surge in severity of mental illness, notably in children and healthcare workers. If you have an opportunity, make a phone call to somebody you think may feel isolated to help cheer up their day. Sports journalism has been ravaged by the coronavirus pandemic, which has wiped out sports schedules and media advertising revenue virtually simultaneously. Without live games for the foreseeable future, the grim new reality has forced many in sports journalism to confront difficult questions about what their storied profession will look like even when activities do resume. From what kind of budgets they'll have to work with to what kind of access they will have to coaches and players. Doctors say for the first time there's a glimmer of hope because they have devised a toolbox, albeit limited and an imperfect one, of drugs and therapies many believe can give today's patients a better shot at survival than those who came only a few weeks before. The menu of treatment options, tried singly and increasingly in combination, includes the blood plasma of COVID-19 survivors, a rich source of antibodies that may help neutralize the virus, drugs to suppress the body's own immune response, which some believe goes into hyperdrive as it tries to fight the invader, anticoagulants that decrease the risk of deadly clots, and finally antivirals such as remdesivir that recently won approval for emergency use from the Food and Drug Administration. In the airline business, social distancing means fewer seats sold, so airfares will go higher. And finally, on the unemployment front, a total of 2.981 million new claims for unemployment insurance were filed last week, which brought the coronavirus total to nearly 36.5 million, by far the biggest loss in U.S. history. That's your Minute with the Mayor. Have a safe weekend. Enjoy your family and friends.